Theo Papageorgiou was described as someone who would go out of his way to brighten up someone else's day. Once on the road to Mount Gambier, somewhere between Pinaroo and Bordertown, he helped a young woman who had run out of petrol 50 kilometres from the nearest town. He took her to fill up a jerry can of diesel and didn't leave her side until the car started. Theo's dad, Jack Papageorgiou, thinks of his son every time he's driving on that road.
And every time I go to Mount Gambier, because my wife comes from there, I remember when this young man, that he cared about people, but when he needed help, help never came. That's what hurt us.
Theo was 27 when he died from suicide in January 2016, after years of struggling with mental illness and failed attempts to seek medical help. In the days before his death, Theo presented to the Riverland General Hospital in Berry, but he was sent home.
When I have my 27-year-old son grabbing my hand, kissing it and saying, "I love you, Dad, sorry, Dad," to me, that was alarming.
In 2021, a coronial inquest found Theo's death was preventable. He was misdiagnosed and his case was mismanaged by the health system.
Given the inquest, the findings, who takes responsibility of Theo's mismanagement? Let's face it, the system is failing. It's up to the members of Parliament, the Government of the day and the Minister of the day to address it, engage himself with the community and come up with a better health system.
Theo's case significantly contributed to the South Australian Law Reform Institute's review of the state's Mental Health Act, which was handed to the state government last week. There's a total of 61 recommendations in the report, but this one, about improving access to patient records, was most powerfully highlighted by the Papageorgiou family.
So it's obvious they need to completely review the way we deliver service.
Decisions around Theo's medication and treatment were made without an understanding of his complete mental health history. The coronial inquest found this lack of clinical file sharing to be a contributing factor to Theo's death.
There's got to be some transparency. There's got to be better communication between emergency and between the health system.
The review's lead author, Olga Pandos, says information sharing issues are particularly problematic for regional, rural and remote hospitals and services.
So we've made some recommendations to the government to explore better alternatives for information sharing across local health networks so that patient records can be accessed more easily.
Theo sought treatment for his mental illness from a range of service providers in the Riverland, but the coronial inquest found there was inadequate continuity of care, partly due to an understaffed and transient workforce. Jack Papageorgiou says South Australians deserve equal health care, regardless of where they live.
There's got to be a better way to service the region. And we are part of South Australia. And too often, our regions get left behind.
These concerns were echoed throughout the SA Law Reform Institute's community consultation, with Ms Pandos hearing about significant issues for regional people's access to mental health services.
We did find there was a shortage of medical specialists to see. There were wait times and costs. We have specifically asked the government to further review and investigate resourcing and staffing. And staffing relates to both retention of staff, but also resident specialists, infrastructure and funding of regional, rural and remote mental health services, because there is a clear disparity in relation to mental health services in metropolitan versus regional centres.
Health Minister Chris Picton says the state government is now carefully considering the 61 recommendations and 11 suggestions and will undertake further consultation with key mental health stakeholders and consumer groups. In a statement, Mr Picton said he's met with Theo Papageorgiou's dad and mum, Jack and Poppy, several times and is keen to meet with them again before bringing new laws to Parliament.
I've got confidence that Chris Picton will take this on board, and I just hope he's got support within the Cabinet, and most important, that when it goes to Parliament, that all members of Parliament listen to the people on the ground and make sure they take that on notice to improve a system that is broken.
Jack says it's been his family's aim since 2016 to help create a better mental health system, and he wants to see all of the recommendations and suggestions implemented. But as they continue to fight to improve the lives of regional people, Jack and his family never cease to honour Theo's memory and find happiness in life.
Theo he was our first child in our lives, and he brought us plenty of joy. We had 27 years of love and care. He was committed to his mum and dad. He was a hard-working person.
Jack pulls out his phone and looks at a photo of his grandchild, a grandchild who bears a name in his late son's memory.
Our daughter sends constantly photos and plenty of video shots of him, and when I do go down, I just hold him by the arms, and that's what gives me a relief and a joy that I do have a son with me again.